But in terms of mortality, the low challenge pig barn, the mortality was 3.3%, and the high challenge barn, the mortality was 19.9%. So huge mortality. And the medium challenge barn was 7.7%. So it ended up, sort of alluding to the economics a little bit later on. The percentage of pigs that went to market as full value pigs in the low challenge barn was just over 89%. And in the high challenge barn, it was just under only 71% went to market as full value pigs. So that was a big hit right there.
Welcome to the Swine Health Blackbelt Podcast, the latest swine health research digested for you. My name is Dr. Clayton Johnson. I'm the host of the podcast. And joining me this week is Dr. John Patience. Dr. Patience is a professor emeritus of animal science at Iowa State University, where he spent 13 years. And prior to that, John was affiliated with the Prairie Swine Center. John, thank you very much for coming on the podcast. And why don't you give folks a little bit more background about yourself, your history in the swine industry?
Thanks, Clayton. It's a real pleasure to be here and chatting with you today. And as far as my background is concerned, I was born and raised in Southern Ontario on a farm that ultimately we got rid of the dairy cows, got rid of the chickens, got rid of everything except the hogs. The hogs remain. And so that was my beginning. I worked and lived out in Western Canada for 20 plus years in Saskatchewan. That's where I really cut my teeth in extension, and then in the feed industry, and then in research. And then in 2008, I retired from Prairie Swine Center, and a job came up at Iowa State University in swine nutrition. So I went down there for 13 years and had a great time. Just, if you can't be successful in swine nutrition at Iowa State University, you can't be successful anywhere, because there's so many pigs all around you and so many really supportive people.
Yeah, lots of resources there at the university, and certainly we appreciate everything they do to make all of us smarter farmers. And, John, we're going to talk today about the economics of pig farming. And it's been a challenging time from Canada to the United States and pretty much everywhere in the world. It's been a challenging economic time. And I know you've seen the industry go through these cycles, before. But you're here today to talk to us a little bit about a paper that you contributed to where you looked at the economics of pig production under different health conditions. And I think this is a really important topic because, producers understand intuitively that sick pigs are bad for their bottom line, but I know producers struggle to value, okay, my pigs are sick, what is that really costing me? And you guys went through a unique case study situation where you could monitor pigs of different health status and really try and answer that question. What's it cost me to have sick pigs? So, John, why don't you talk to us a little bit about that unique opportunity, what you looked at there, what you studied, and what you learned from it?
Great. Well, yeah, it was a unique opportunity. And when I mentioned in the introduction that there's a lot of resources in Iowa and very supportive industry, Iowa Select Farms gave us this unique opportunity to do this study. And a graduate student, Alyssa Cornelison, who was working for Iowa Select Farms, and they supported her master's research. And so what Alyssa did was there was 3 barns on their site. It's actually 4, and we used 3 of them. 1,000 head barns that were right beside each other, only separated by about 50 feet, and just had this opportunity where the pigs had different health challenges across those 3 barns, and we called them the low, medium, and high health challenge barns. And Alyssa, by imposing just really strict biosecurity activities in terms of how she moved from barn to barn and what she moved from barn to barn and so on, was able to maintain those 3 health challenge levels throughout the course of the experiment, which in itself was a heck of an accomplishment when they were that close. But so we had low, medium, and high health challenge. All 3 of the barns, the pigs tested positive for PRRS, but the low health challenge pigs never did test positive for the influenza A virus. And so we categorized the pigs based on oral fluids testing on the basis of clinical symptoms, working very closely with Dr. Locke Carricker at that school in Ames, and he provided that side of things for us for the study. And so Alyssa then monitored the performance, the traditional performance of growth performance and so on, studied the mortality, morbidity, the number of treatments that were applied in the 3 barns, and then did economics when it was all said and done, modeling out 24, these were 1,000 head barns, but she modeled it up to 2,400 head barns because that's a little more typical of commercial reality. So that was the kind of the backdrop of what she was working with, Clayton.
Very good. Well, John, tell us a little bit about what she learned. Maybe we can start with just kind of the performance side of things, the production numbers. How big of a difference did you see in things like mortality and growth rates at those 3 different levels of health challenge?
Right, yeah. And the mortality was the one that shocked us the most. And actually, growth performance wasn't as dramatic as we would have expected. It was still significant, but it wasn't quite as big as at least I would have thought. But in terms of mortality, the low challenge pig barn, the mortality was 3.3%, and the high challenge barn, the mortality was 19.9%. So huge mortality. And the medium challenge barn was 7.7%. So it ended up, sort of alluding to the economics a little bit later on. The percentage of pigs that went to market as full value pigs in the low challenge barn was just over 89%. And in the high challenge barn, it was just under only 71% went to market as full value pigs. So that was a big hit right there.
Yeah, almost 40% difference.
Yes, yeah, that was dramatic for us. I remember when we were looking at those numbers, we were pretty surprised it was that big. So we certainly knew we had 3 different barns at 3 different levels of health challenge that we were working with. So then when we looked at the actual growth performance, so the pigs started the trial at 29 pounds, and they went to market at about 285. The low challenge pigs, their average daily gain was 1.9 pounds a day. The medium challenge barn was 1.7 pounds a day, and the high challenge barn 1.6 pounds per day. So quite a drop from 1.9 to only 1.6. Feed conversion wasn't as big a difference as I would have expected. The low challenge barn, it was 2.38, and the high challenge barn was 2.5, and the medium challenge barn was 2.5. And so that was, so I would say that maybe in terms of growth rate, they got hit maybe more than we thought. But in terms of feed conversion, I would have expected a bigger number, a bigger difference between them from 2.38 to 2.50. That's, 12 points isn't a huge difference when you look at the mortality that we were dealing with.
Salmonella presents significant challenges to pig health and performance and poses food safety risks to humans. As the first and only vaccine offering live attenuated strains of both Salmonella cholerae and Typhimurium, Enterosol Salmonella TC from Boehringer Ingelheim protects pigs against both serotypes with a single oral dose. Talk to your Boehringer Ingelheim representative to learn more.
Well, we should thank our audience, John. Without them, we certainly couldn't be doing this. For everybody out there, we really appreciate you listening to the Swine Health Blackbelt Podcast. If you haven't seen our website, please go check it out at swinehealthblackbelt.com. If you haven't subscribed, please subscribe so that you get not only this wonderful episode with John, but all the episodes we put out every week. And please, if you enjoyed it, tell a friend, forward this episode to somebody. We really appreciate that word of mouth communication and recommendations. For Dr. John Patience, I'm Dr. Clayton Johnson. It's been our pleasure to bring you this episode of the Swine Health Blackbelt Podcast. Please have a great rest of your day.
Hey, everybody. We're always searching for the latest and greatest research to share each week. If you have a swine health-related research trial and would like to come on the show and talk about it, share it with us, please feel free to email the research to hello@wisenetics.com. That's HELLO@WISENETIX.com.